Imagine a treasure hunt, not for gold, but for billions hidden in plain sight inside America's healthcare system. This isn't fiction. It's the reality behind the largest medical fraud in U.S. history, sprawling $15 billion scheme that stunned federal agents and exposed cracks in the nation's most vital programs. The story began in early 2023, when federal agents quietly launched Operation Gold Rush, sweeping investigation targeting a transnational crime network based in Russia and Eastern Europe. This was no amateur operation. The group had purchased more than 30 legitimate medical supply companies across the United States, not to run them, but to exploit them. Their plan was to flood Medicare with over $10.6 billion in fake claims for durable medical equipment, mostly for essential items like urinary catheters. They didn't just build the system, they built a machine. Shell companies, stolen identities, and forged documents were used to create a seamless money laundering operation. Funds were moved through U.S. banks and foreign accounts hidden in plain sight. Names began to emerge: 𝗵𝗵𝗶, 𝗧𝗿𝗂𝗵, and Boris Manov, whose company, 𝗦𝗵𝟑 Equipment Incorporation, submitted $8.2 million in fraudulent Medicare claims. After 2 years of coordinated surveillance, financial tracking, and undercover operations, the Justice Department made its move. On June 30th, 2025, they announced the results of their massive takedown. In total, 320 people were charged, including 25 doctors and nearly 100 other licensed medical professionals. Authorities seized $245 million in cash, cryptocurrency, luxury vehicles, and high-end assets. Federal officials made one thing clear: organized crime has found fertile ground inside the U.S. healthcare system, especially Medicare and Medicaid. But even with the size of this operation, officials admitted it was only a glimpse of what's happening on a much larger scale. The fraud, though massive, is just one example of how easily billions can disappear in a system built on complexity and weak oversight. To put things in perspective, the United States spent approximately $4.9 trillion on healthcare in 2023. In contrast, China, with 4 times the population, spent only $2.3 trillion. The cost differences are just as staggering on the ground. A CT scan and blood test in China might cost $67, while the same procedures in the U.S. could run as high as $3,000 even after insurance adjustments. Operation Gold Rush did. It's not just expose a criminal ring, it revealed the deep vulnerabilities of a healthcare system that has been bleeding money for years. Behind the glossy corporate logos and provider names lies a system that, when left unchecked, allows criminal networks to thrive. And if $15 billion can be siphoned away before anyone notices, it leaves a disturbing question hanging in the air. How much more is vanishing right now?